This part of the course is intended to help you think through why you've suggested the problems that you want to deal with. What was the evidence or the thinking behind the choice of those projects? And in a likewise way, to think about how you chose the various solutions that you're applying to solve these problems. It's important to ask the right questions. If you're not asking the right questions, it doesn't matter what a good job you do, because you're not going to be working in the right area. So it's important to be very thoughtful about your own biases, but also about the process by which, as I said, your problems get defined, prioritized, and likewise the solutions get chosen and implemented. In one of the supplemental readings from McKillop, he includes a sentence that I've always found to be very stimulating. He talks about needs. And essentially, when we're developing programs, we're trying to meet needs. And he describes a need as a value judgment that some group has a problem that can be solved. So there are 4 elements to this sentence that I think are worth thinking about. What we do, what you're doing, represents a value judgment. It might be your values, it might be the Ministry of Health's values, it might be WHO's values, it might be the community's values that you're dealing with. But everything, virtually everything we do is based on a preconception of what is important and who gets to decide what's important. What we're dealing with here also relates to groups. Many of you are individual practitioners on individual scale and take care of patients, but today we're talking about needs of groups, whether they're adolescents, whether they're children or community members at risk of drowning, whether they're infants born of mothers with HIV. These are groups that we're dealing with. We're also trying to be as precise as possible about what it is. What is the problem that we're trying to solve? And when I read over your descriptions, your outlines of your projects, sometimes it was very clear what you were trying to solve, and sometimes it wasn't as clear. And we'll go over that as we move through this. And lastly, when you define a need and specify a problem, there's an implicit belief that it's solvable. If it wasn't solvable, you'd be working on something else. You wouldn't just be knocking your head against the wall. So all of these things are implicit in what you're doing, and my job this morning is to help make it more explicit about how these things are worked through in your particular context and with your particular area. So problems, which I forgot to read, but maybe you could read, is defined as an inadequate outcome or an outcome that violates expectations. And again, whose expectations? Is it yours as a clinician? Is it the Ministry of Health? Is it the World Health Organization? Is it the Gates Foundation? Is it the community? Whose expectations are being violated to say that there is a problem here? So what kinds of problems are we dealing with? Well, to some extent, or for many of you, it's a disease or a health problem. Rickets, neonatal sepsis, diphtheria, neonatal mortality, drowning, HIV. So some of you have described very specific medical health disease type problems. Some of you have, I think, defined your problems in terms of behaviors, adherence to HIV treatment, health-related behaviors among adolescents. So the problems that are seen are not necessarily that there are high levels of disease, although that might be a problem, but that there are low levels of doing the right thing behaviorally. Some of you have defined your problems as healthcare or health systems problems or health policy problems. So HPV vaccination policies, appropriate antibiotic use in the hospital, screening systems. So you've defined your problems as inadequacy in healthcare. And then, just to be complete, for some of you, it's an awareness problem. It's a status problem. It's not a behavior. It's not a disease. But it's that people aren't aware of things, and that's what you're trying to address in your interventions. So maybe this is obvious to you, but why is it important to be very specific and very clear about the problem that you're addressing? Well, for one reason, it will help you decide what you want to accomplish or what you're actually trying to get done. And it will, skipping down to the bottom, it will help you define what success will mean if you actually accomplish what you want. And therefore, it immediately relates to the evaluation. So many of you say, how do we evaluate? How do we evaluate? Well, you have to know what success would be in order to know what to evaluate. For whom? So most of you, I think, in your projects, more or less describe the target population, a district, a hospital, part of the country. But again, it's very important to be clear on whom you're trying to make a difference with. And these are all important, as will, I think, be probably apparent to everyone, in order to make the case, primarily or often to funders who need to be convinced that what you're addressing is in fact a problem. The stakeholders that many of you have defined need to be educated that there is a problem and why it's an important problem. And the community or the target population that you're dealing with also need to be very clear on what your program is addressing. Now, this may be a little obscure, but again, if you're trying to convince somebody that something is a problem, how do you do that? Well, often it's implicit, but people make comparisons. So we've heard about the high neonatal mortality rate. Implicit in that is that it's higher than it should be. Also, neonatal mortality hasn't changed, so the trend is not what you want. You're expecting a declining trend, and instead it's constant. That is a cause for concern. For some situations, I don't think anybody has, well, I think diphtheria is probably a good example. Any case of diphtheria is a problem. So it's not just that the rate is high, it's that you have any of it in that particular population. Or cholera, or smallpox. You don't need a lot of statistics to make the case that there's an issue. And then lastly, a lot of problem definition is subjective. It's in the news. It's the pet peeve of a community leader or a philanthropy. And so it's not based necessarily on any statistics or any evidence. It's a subjective. But nonetheless, it can be a very powerful reason for defining something as a problem. So I think it's important to be clear as to who actually decides on what the problem is that you're addressing. Listening to you, many of you seem to indicate that this is something you've experienced in your day-to-day work and have decided this is something that you would like to see changed. For some of you, it's national policy that you're trying to change. Somebody else has defined this as a problem, and you're trying to figure out how to solve it. It's not unusual that funders define problems. I didn't hear anything in this group, but it is not unusual that somebody who makes something, usually something expensive, thinks it's a problem that that thing is not being used as much as it should. So they define the problem as lack of penetration of their machine or their diagnostic test or what have you. And then lastly, I don't think any of you, might be wrong, mentioned that the community or community leaders or citizens had come to you and say, this is something that is a problem. But it does happen, it should happen, and it has to happen, and you'll get to that when we talk about stakeholders, because you can't do anything very successfully unless you have the target population on board. Now, one of the readings that I assigned talked about evidence-based. So one of your tasks is to find the evidence, make the case for why things are a problem. So where do you get that evidence? Where do you get those data? Well, in some cases it's surveillance systems. So I would guess that the neonatal statistics that you quoted are probably from the demographic and health surveys or something like that, or from a national vital records surveillance. Sometimes it's from administrative data. So if you're working in a hospital and they say, well, how many babies were born and how many babies died, it's not a public health data system, it's an administrative system for the hospital, and that's how you collect your data to make your case. National and local surveys are expensive. Fortunately, many of them are done by the government or USAID or WHO, but these are other sources of information. And then lastly, qualitative information, which everyone generally thinks is weaker than statistical information. But in my old and jaded view, I think that qualitative information is very important. Listening to people, hearing their stories, hearing their concerns. You may not have statistics to back it up, and unfortunately, sometimes anecdote, qualitative information is not as persuasive as statistical information, but it can be very powerful in terms of making the case that something is a problem. Particularly to legislatures. In the United States, I mean, you could have all the statistics in the world, but you march a mother of a child who has a problem in front of the legislature and you know, make their hearts feel badly, and you can get a bill passed to fund a rare disease. So anecdote can be a very powerful way of documenting and making the case for the problem that you're concerned with. You won't be able to read the fine print, but I thought it would be fun to just look at some of the data sources that are available online. How many of you are familiar, for example, with the Global Burden of Disease Study and the data that they've provided? Okay. How many of you look at WHO data to look at your issues in your country? I will send you actually this slide pack so that you can then click on this rather than have to type in these long URLs if you're interested. But I thought it might be interesting if I can do this. We'll see if, just to show you, well, maybe I won't. Well, rather than take time now to see if we can get this to work, we'll come back to it later, maybe after the break. But I think you'll find it interesting to see just how much data is cataloged in relatively few places on the web. So sort of in summary, if you're describing your problem of interest, your situation that you want to deal with, in a proposal, which is often kind of where the rubber hits the road, you have to make the case to somebody. It can be to a funder, it can be to a government agency, it can be to a community group. It's important be clear on what the need or problem that you are addressing, whether it's a behavior or a disease or a system issue. Obviously, you need to say among whom. It's important to say what is the magnitude of the problem and to document why you feel this is a concern at this time in your community. So all 4 of these elements need to be explicit in your own mind and often articulated in a document that you seek to gain support for your efforts. So moving to solutions, again, I think it's helpful to be very clear on what you're doing or want to do and why you want to do it. So solutions to the problems that you've described come in many different flavors. A drug, an immunization. A lot of you have talked about professional education and retraining or improving healthcare through professional changes in professional behavior. Some of you have talked about community or public health education, improving awareness, improving behaviors of various people. I didn't put down here policy. Changing a policy is, in some cases, the solution to the problem or one of the solutions to the problem that you're trying to deal with. They're engineering solutions. So putting a fence around something that's dangerous is a solution to people falling into dangerous water. Traffic improvement is a solution to high fatality rates, pedestrian fatality rates, and what have you. So again, the question is, how do we choose the solution that that you're interested in? And again, the current it's not a fad. The current there's a word, but I can't think of it. Anyway, what people want you to do these days is to use evidence, to provide something from the literature, from New England Journal of Medicine, from Lancet, from WHO, that says this works. This is an effective approach to this problem. But not always. Sometimes, as I mentioned, the funder has his or her or their own idea of what you should be doing, a protocol, a drug, what have you. And thirdly, although very few people will tell you this, sometimes it's good to be creative. So you've talked about developing a questionnaire. Now, there may be one out there, a checklist, but maybe there isn't. But that shouldn't prevent you from trying it if you think it's a good idea and you don't see other alternative ways of doing it. But if you do implement solutions that are not evidence-based, it is particularly important to evaluate what you're doing and their effectiveness. I guess one other thing to mention here is that all of you have described really difficult problems: neonatal mortality, drowning, adolescent behavior. And it's important to realize and to have humility and patience that no matter how successful you are in implementing what you want to implement, you will not necessarily solve the problem. You'll chip away at it because most of these issues are not just one cause, one solution types of situations. I looked at your responses to our request for summaries, and these are some of the examples or some of the things that you mentioned, so you can get a sense of how varied your own thinking is about what to do, what your solution is. Awareness campaign about HPV vaccination and policy changes having to do with making HPV mandatory. Professional education, for safe delivery practices and equipping the delivery rooms with safe supplies or sterile supplies. Effective service delivery model for adolescents. Professional education about antibiotic use for respiratory illness in pediatrics. Screening programs for sickle cell disease. Patient and professional education about the importance of vitamin D supplementation, and from what I've heard this morning, a politician or Ministry of Health education about why this is important. Diphtheria vaccination, as we've increased coverage for diphtheria vaccination, although even that can be modified. So my experience, as I think I mentioned, was with smallpox. And originally, historically, the way to prevent smallpox or to control smallpox, eliminate smallpox, was mass vaccination. You just vaccinate everybody. And during a crisis in, I believe it was Nigeria, they didn't have enough vaccine to vaccinate everybody. So they decided that they would target vaccination around cases of smallpox. It was called surveillance and containment. So they went from mass vaccination to surveillance and containment. And it was shown to be much more effective in bringing the incidence of smallpox down to zero than mass vaccination had been. And I think that was about 3 or 5 years before smallpox was eliminated, and many people feel that that change in strategy or approach to vaccination was one of the reasons the smallpox program was so successful. CPR training, some environmental changes, and some behavioral changes in the area of drowning prevention, health diaries, and then health systems strengthening in a variety of areas having to do with professional education, public awareness, systems change, and what have you. So I display this just so you get a sense that there's no one kind of solution, and the choice of a solution is a challenge. It's not just you've got a problem and there's a solution you can take off the shelf. Much of the work that you need to think about is what will be most effective. Again, coming back to this notion of evidence-based, why is it good to have evidence-based interventions? Well, the funders often demand it. If something works, I guess, and you try it, it improves the likelihood of success. And conversely, if you discover that it's not effective, it reduces the likelihood of wasting your time. So many of you, or some of you, have suggested certain strategies. For example, I don't know the literature, swimming lessons. Have people found that swimming lessons are actually effective in reducing drowning rates? And if they have, are those data, are those studies relevant to the communities that you're interested in? And if they're not, then you can decide to do it, but it's not really evidence-based. You might be right, but it's no longer something that you can claim there's a clear record of evidence for. The disadvantages of relying on an evidence-based solution is that it sort of precludes creativity and specificity. So things that work in some settings may need to be modified in major ways to work in your own. Evidence that works for one population, or a solution or an intervention that works in one population may be totally irrelevant and ineffective in your own population, target population. And then lastly, most evidence is actually yesterday's news. How do we know something works? Well, because there's been a clinical trial. Have any of you been involved in a clinical trial? Do you know how long it takes to get a clinical trial started and published? It's like 5-10 years. And then it's just one clinical trial, they got to repeat it. So what is, quote, evidence-based is often what people did 10 years ago. The field might have moved quite rapidly between the time that those interventions were tested and the present time. There was a wonderful article in the New Yorker magazine about cystic fibrosis treatment. And they keep very good statistics on survival and quality of life for children, adults with cystic fibrosis in the United States. So there are various centers, and they can compare the centers. And there's one center, I believe it's in Indiana, that has the best outcomes of all. And they asked the head of the center, do you use evidence-based medicine? He says, hell no. He says, if I used evidence-based medicine, we'd never try anything that's working so well. So I don't mean to be a naysayer and contradict all the readings that you had, but sometimes relying on evidence-based or evidence-proven therapies or solutions is not going to be the best choice that you can make. Again, this is pretty much the same slide as before. Who chooses the solution that you're implementing? Is it the government? Is it you as an investigator or a local authority? It's the community, or is it the funders or other groups? Again, it's important to think about that, not because you may have a lot to do to change it, but at least you're aware of why you were doing what you were doing, what you have control over and what you don't. And if what you're doing is something, for example, that's fully supported by the funders, well, it's going to be a lot easier to work with those folks as stakeholders than if you're doing something that's not supported by the funders, and likewise, community, et cetera, government, Ministry of Health, what have you. Briefly, we will try to distinguish between solutions, as I've described them, and strategies, which we'll talk about later this afternoon. Solutions are sort of what the specific nugget of change you're trying to accomplish. And strategies are how you go about it. So you may say that what you want to do is increase vitamin D supplementation among children. That's your solution. The strategies may involve public awareness campaigns, working with the legislature, the Ministry of Health, et cetera, et cetera. It's how you go about getting that solution implemented. So almost lastly, again, in a proposal, if you're writing one, what is the solution? What is the target audience? What is the evidence, either direct or often theoretical, because there may not be any direct evidence that an idea will work. And I'm not sure why that's in there, so we'll move on. So now, what we'd like to do is break you up into groups, 3 groups. Kenny has figured out who's in whom, in which.
I'd like to confirm with you.
Okay, first we'll caucus. And among the groups, there'll be 3 or 4 of you in each group. Discuss with one another how you chose the problem that you've described to us in writing and in your verbal descriptions, and why and how you chose that problem, and subsequently how what is the solution that you are proposing, and how did you choose it, and what did you eliminate? What did you not choose in the process of thinking about how to solve the problem of interest? I hope that you'll challenge and question one another, and the outcome of this might be that you'll want to change a little bit how you describe your issues and how you describe your interventions the next time you revise the kinds of forms or outlines that we gave you a couple of weeks ago.